The United States could soon face rising medication costs and potential drug shortages as President Donald Trump's sweeping 10% tariff on Chinese imports takes effect. Experts warn that the new tariffs, which include pharmaceuticals and medical supplies, may disrupt the supply chain and impact millions of Americans who rely on affordable generic medicines. China plays a critical role in the U.S. pharmaceutical industry, supplying essential raw ingredients for a wide range of medications. These include everyday painkillers, antibiotics, blood thinners, cancer treatment drugs, and cardiovascular medications. In 2023 alone, the U.S. imported over $2.02 billion worth of pharmaceutical products from China, according to the U.S. Trade Commission. Industry leaders and healthcare organizations have raised serious concerns about the consequences of these tariffs. The American Hospital Association has urged the administration to exempt medical supplies and pharmaceuticals, warning that shortages could put patients at severe risk. In a letter to President Trump, the association stated, "Tariffs, as well as retaliatory actions from affected countries, could reduce the availability of life-saving medications and supplies in the U.S." The impact of these tariffs is expected to be particularly severe for the generic drug market. John Murphy III, President and CEO of the Association for Accessible Medicines, highlighted the challenges facing manufacturers. Generic drug companies operate on extremely tight margins, often selling at a loss. A tariff increase will make it even harder for them to stay in the market, he explained. Over the past 5 years, the total value of generic drug sales in the U.S. has dropped by $6.4 billion, despite an increase in demand. If tariffs are imposed, the situation will worsen. China supplies approximately 30% of the active pharmaceutical ingredients used in U.S. medications, making it a vital part of the country's healthcare system. Beyond pharmaceuticals, China is also a leading supplier of essential medical equipment, including single-use blood pressure cuffs, anesthesia instruments, and stethoscope covers. Nearly one-third of all disposable face masks and the vast majority of plastic gloves used in the U.S. come from China. For patients battling serious illnesses, even a brief disruption in medication availability could be life-threatening. Carefully timed chemotherapy treatments, antibiotic regimens, and cardiovascular medications must be administered without delay to ensure the best possible health outcomes, the American Hospital Association emphasized. Over the past decade, the U.S. has increasingly depended on foreign countries for pharmaceutical production due to lower manufacturing costs abroad. However, with the new tariffs in place, Americans may soon face higher drug prices and limited access to critical medical supplies. As the situation unfolds, the healthcare industry is bracing for potential consequences, and patients across the country are left wondering how these changes will impact their access to essential medications.